Question 1. The monitoring system demonstrates significant signal degradation due to a combination of muscle artifact and environmental electrical interference. The practitioner needs to optimize the signal processing to ensure accurate neurofeedback training. Which of the following strategies best aligns with professional best practices for signal optimization in this scenario? Option A. Apply a broad-spectrum notch filter to eliminate all potential sources of interference, regardless of their specific frequency or origin, before any visual inspection of the raw data. Option B. Manually adjust the amplifier gain to a very high setting to overpower any incoming noise, assuming that the neurofeedback software will automatically compensate for any resulting signal distortion. Option C. Proceed with neurofeedback training using the raw, unfiltered data, relying solely on the client's subjective feedback to gauge the effectiveness of the session. Option D. Implement a multi-stage artifact rejection protocol that visually inspects and flags segments containing muscle activity, followed by a targeted digital filter to address the specific frequency characteristics of the environmental electrical interference. The correct answer is D. Implement a multi-stage artifact rejection protocol that visually inspects and flags segments containing muscle activity, followed by a targeted digital filter to address the specific frequency characteristics of the environmental electrical interference. Explanation. The monitoring system demonstrates a common challenge in neurofeedback: the presence of artifacts that can distort the raw EEG signal, potentially leading to inaccurate interpretations and suboptimal treatment protocols. The professional challenge lies in distinguishing genuine neurophysiological activity from these extraneous signals to ensure the efficacy and safety of the neurofeedback intervention. This requires a deep understanding of signal processing principles and their application within the BCN certification framework. The correct approach represents best professional practice because it prioritizes the integrity of the data before applying algorithmic filtering. By first identifying and characterizing artifacts, the practitioner can make informed decisions about the most appropriate filtering strategies. This aligns with BCN ethical guidelines that mandate accurate data collection and responsible application of technology. It ensures that interventions are based on a true representation of brain activity, thereby maximizing therapeutic benefit and minimizing the risk of misinterpretation or inappropriate treatment. An incorrect approach that involves applying a broad-spectrum filter without prior artifact identification is professionally unacceptable. This fails to adhere to the principle of data integrity, as it may inadvertently remove genuine neural signals along with artifacts, leading to a distorted view of brain function. Ethically, this constitutes a failure to provide competent care, as the intervention is not based on accurate assessment. Furthermore, it may violate BCN guidelines regarding the responsible use of technology and the need for evidence-based practice. Another incorrect approach, applying a filter that is too aggressive or too lenient without understanding the specific artifact types, also presents regulatory and ethical failures. An overly aggressive filter can suppress legitimate brainwave activity, rendering the data useless for training. An overly lenient filter might allow artifacts to persist, leading to inaccurate feedback. Both scenarios represent a failure to exercise professional judgment and a departure from best practices in signal processing for neurofeedback, potentially impacting client outcomes and violating ethical standards of care. The professional reasoning process for such situations involves a systematic evaluation of the incoming EEG data. This begins with visual inspection for obvious artifacts. Following this, understanding the characteristics of common artifacts, e.g., muscle, eye blinks, electrical interference, is crucial. Based on this understanding, the practitioner then selects and applies appropriate signal processing techniques, including artifact rejection or correction methods and judicious filtering. The goal is always to obtain the cleanest, most representative EEG signal possible for analysis and training, in accordance with BCN standards. Question 2. The assessment process reveals that a client who has been informed of a neurofeedback protocol deemed most appropriate by the practitioner based on their assessment expresses a strong preference for a different, less evidence-based protocol that they researched online. The client insists on proceeding with their preferred protocol, citing anecdotal success stories. Option A. Suggest a trial of the client's preferred protocol for a short period, without providing extensive education on its potential limitations or risks, to see if it yields satisfactory results. Option B. Engage in a detailed discussion with the client, explaining the scientific rationale for the recommended protocol, addressing their concerns about the research protocol, and collaboratively exploring modifications or alternative approaches that align with both clinical best practices and the client's stated goals. Option C. Immediately proceed with the client's preferred protocol as requested, prioritizing client autonomy above all else, even if it deviates from established clinical guidelines. Option D. Firmly insist on implementing the practitioner's recommended protocol, dismissing the client's research as unreliable and explaining that the practitioner's expertise is paramount. The correct answer is B. Engage in a detailed discussion with the client, explaining the scientific rationale for the recommended protocol, addressing their concerns about the research protocol, and collaboratively exploring modifications or alternative approaches that align with both clinical best practices and the client's stated goals. Explanation. The assessment process reveals a common challenge in neurofeedback practice, balancing client autonomy and informed consent with the practitioner's ethical responsibility to ensure safety and efficacy. This scenario is professionally challenging because it requires navigating potential conflicts between a client's expressed desires and the practitioner's clinical judgment, particularly when those desires might lead to suboptimal or even unsafe outcomes. Careful judgment is required to uphold ethical standards while respecting the client's right to make decisions about their own care. The correct approach represents best professional practice because it prioritizes a collaborative and educational process. By thoroughly explaining the rationale behind the recommended protocol, addressing the client's concerns directly, and offering alternatives that align with both clinical evidence and the client's goals, the practitioner upholds the principles of informed consent and client-centered care. This approach ensures the client understands the potential benefits and risks, empowering them to make a truly informed decision. This aligns with the ethical guidelines for neurofeedback practitioners, which emphasize transparency, client education, and the practitioner's duty to provide competent and evidence-based care. An incorrect approach that involves proceeding with the client's preferred, but potentially suboptimal, protocol without further discussion or education fails to adequately inform the client of potential risks or limitations. This could be seen as a breach of the duty of care and informed consent, as the client may not fully grasp the implications of their choice. Ethically, practitioners are obligated to guide clients towards the most effective and safe treatment options based on their expertise. Another incorrect approach, that of dismissing the client's concerns and insisting on the practitioner's initial protocol without attempting to understand or address the client's perspective, demonstrates a lack of respect for client autonomy and can erode trust. This can lead to client dissatisfaction and potentially non-adherence to treatment, undermining the therapeutic relationship and the effectiveness of the neurofeedback intervention. It also fails to meet the ethical standard of collaborative decision-making. The professional reasoning process for similar situations should involve a structured approach. First, actively listen to and validate the client's concerns. Second, clearly and concisely explain the clinical rationale for the recommended protocol, including potential benefits and limitations. Third, explore the client's underlying reasons for their preference and collaboratively problem-solve to find a mutually agreeable path forward, which may involve modifying the protocol or addressing their concerns through other means. Finally, document the discussion and the client's decision thoroughly. Question 3. Which approach would be most appropriate for a BCN certified practitioner to utilize when selecting neuropsychological assessment tools to inform a neurofeedback treatment plan for a client presenting with attention deficits and executive dysfunction? Option A. Administering a comprehensive battery of standardized neuropsychological tests covering attention, executive functions, memory, and processing speed, supplemented by a detailed clinical interview and behavioral observations. Option B. Utilizing a single, widely recognized cognitive screening tool that provides a general overview of cognitive abilities. Option C. Selecting assessment tools based on their perceived ease of administration and the practitioner's familiarity with them, regardless of specific relevance to the client's presenting issues. Option D. Relying primarily on self-report questionnaires completed by the client and their family regarding perceived attention and executive functioning difficulties. The correct answer is A. Administering a comprehensive battery of standardized neuropsychological tests covering attention, executive functions, memory, and processing speed, supplemented by a detailed clinical interview and behavioral observations. Explanation: this scenario presents a professional challenge because a neurofeedback practitioner must select the most appropriate neuropsychological assessment tools to inform a treatment plan for a client presenting with complex cognitive and behavioral symptoms. The challenge lies in the nuanced differences between various assessment instruments and their suitability for specific diagnostic questions and neurofeedback applications, all while adhering to the ethical and legal standards governing the practice of neurofeedback. Careful judgment is required to ensure the assessment is valid, reliable, and directly contributes to the development of an evidence-based and client-centered neurofeedback protocol. The correct approach represents best professional practice because it prioritizes a comprehensive, multimodal assessment that integrates standardized neuropsychological measures with client history and observable behaviors. This aligns with the BCN certification's emphasis on a thorough understanding of the client's neurophysiological functioning, utilizing a battery of tests that assess different cognitive domains, e.g., executive functions, memory, attention, and potentially emotional regulation, allows for a more precise identification of underlying deficits that neurofeedback can target. This approach is ethically sound, as it ensures the treatment plan is based on objective data and a holistic understanding of the client, thereby maximizing the potential for positive outcomes and minimizing the risk of inappropriate or ineffective interventions. Regulatory frameworks for neurofeedback certification often mandate that practitioners operate within their scope of competence and base intervention on sound scientific principles and client assessment. An incorrect approach that relies solely on self-report questionnaires, while useful for gathering subjective information, fails to provide objective, standardized data on cognitive functioning. This is a regulatory and ethical failure because it bypasses the requirement for empirical evidence to guide treatment, potentially leading to misdiagnosis or an ineffective protocol. Another incorrect approach that uses only a single, broad-spectrum cognitive screening tool may lack the specificity needed to identify the precise neurophysiological patterns that neurofeedback can address. This represents an ethical failure to conduct a sufficiently thorough assessment, potentially leading to a superficial understanding of the client's needs and a suboptimal treatment plan. An approach that selects assessment tools based on their popularity or ease of administration, rather than their psychometric properties and relevance to the client's presenting concerns, is also a regulatory and ethical failure. It demonstrates a lack of professional diligence and a disregard for evidence-based practice, potentially harming the client by delaying or misdirecting effective treatment. Professionals should employ a decision-making framework that begins with a thorough review of the client's presenting problem and referral questions. This is followed by an informed selection of assessment tools that are psychometrically sound, relevant to the suspected deficits, and within the practitioner's scope of practice. The process should involve considering the strengths and limitations of various assessment modalities, integrating findings from multiple sources, and using the assessment data to collaboratively develop a targeted and individualized neurofeedback treatment plan. Question 4. The review process indicates that a neurofeedback practitioner is setting up their system for a new client. To optimize the calibration process for this specific individual, which of the following actions is most crucial for ensuring accurate and effective neurofeedback delivery? Option A. Performing a baseline assessment to establish the client's typical brainwave patterns, and then adjusting the system's thresholds and gains based on these individual readings, ensuring the feedback is responsive to the client's unique neurophysiology. Option B. Utilizing the manufacturer's default calibration settings without further adjustment, assuming they are universally applicable to all clients. Option C. Skipping the detailed calibration steps and proceeding directly to the treatment session, relying on the system's general operational parameters. Option D. Conducting calibration only at the beginning of the entire treatment course and not re-evaluating it unless the system malfunctions. The correct answer is A. Performing a baseline assessment to establish the client's typical brainwave patterns, and then adjusting the system's thresholds and gains based on these individual readings, ensuring the feedback is responsive to the client's unique neurophysiology. Explanation. The scenario presents a common challenge in neurofeedback practice. Ensuring system calibration aligns with individual client needs and evolving physiological states while adhering to professional standards. The challenge lies in balancing the technical requirements of system setup with the clinical imperative of providing effective and ethical care. Professionals must exercise careful judgment to avoid compromising data integrity or client safety due to suboptimal calibration. The correct approach represents best professional practice because it prioritizes a systematic, individualized, and documented calibration process. This aligns with the ethical obligation to provide competent care and maintain accurate client records. Adhering to manufacturer guidelines and established protocols ensures the neurofeedback system is functioning optimally for the specific client, thereby maximizing the potential for therapeutic benefit and minimizing the risk of inaccurate feedback. This meticulous approach supports the integrity of the neurofeedback process and demonstrates a commitment to evidence-based practice. An incorrect approach that relies solely on default settings without client-specific verification fails to meet the standard of individualized care. This can lead to inaccurate data collection and ineffective treatment, potentially violating ethical principles of beneficence and non-maleficence. Another incorrect approach that bypasses regular calibration checks, especially when client presentation changes, risks providing feedback based on a system that is no longer accurately reflecting the client's brain activity. This can result in a misinterpretation of progress or a lack of response, undermining the therapeutic alliance and potentially leading to inappropriate treatment adjustments. A third incorrect approach that neglects to document the calibration process leaves a gap in the client's record, hindering continuity of care and making it difficult to troubleshoot issues or demonstrate adherence to best practices if audited. This lack of documentation can be considered a failure in professional record-keeping standards. Professionals should employ a decision-making framework that begins with understanding the client's presenting issues and treatment goals. This informs the selection of appropriate protocols and the necessary calibration parameters. They should then consult manufacturer guidelines and established neurofeedback literature for best practices in system setup and calibration. A critical step is performing individualized calibration, verifying that the system accurately captures the client's baseline and target brainwave activity. Throughout the treatment, professionals must remain vigilant for any changes in client presentation or system performance that might necessitate recalibration. Finally, meticulous documentation of all calibration procedures, settings, and any adjustments made is essential for maintaining professional accountability and ensuring effective client care. Question 5. The analysis reveals that a neurofeedback practitioner is preparing an introductory presentation for a community health fair. To accurately inform the public about the field's origins and development, which of the following best encapsulates the historical trajectory and foundational principles of neurofeedback, as understood within the context of its evolution from biofeedback and early electroencephalography research? Option A. Neurofeedback's history is solely defined by the groundbreaking work of early pioneers who discovered the direct manipulation of brain waves through operant conditioning, with minimal subsequent advancements in understanding or application beyond their initial findings. Option B. Neurofeedback's history is primarily characterized by its emergence from early biofeedback techniques and the subsequent integration of electroencephalography (EEG) research, leading to the development of protocols aimed at self-regulation of brainwave activity, evolving from foundational work in operant conditioning of physiological responses to more sophisticated, individualized brain-computer interface applications. Option C. Neurofeedback's historical development is best understood as a recent invention, largely disconnected from earlier biofeedback research and primarily focused on experimental therapeutic interventions with limited scientific validation. Option D. The history of neurofeedback is predominantly a narrative of technological advancements in EEG recording, with little emphasis on the theoretical frameworks or the behavioral and cognitive outcomes observed in early research. The correct answer is B. Neurofeedback's history is primarily characterized by its emergence from early biofeedback techniques and the subsequent integration of electroencephalography (EEG) research, leading to the development of protocols aimed at self-regulation of brainwave activity, evolving from foundational work in operant conditioning of physiological responses to more sophisticated, individualized brain-computer interface applications. Explanation. The analysis reveals a scenario where a neurofeedback practitioner is asked to provide a historical overview of the field for a new client. This presents a professional challenge because the practitioner must accurately represent the evolution of neurofeedback, while also ensuring the information is presented in a way that is understandable and ethically sound for a layperson, without overstating claims or misrepresenting the scientific basis. Careful judgment is required to balance historical accuracy with client education and informed consent. The correct approach represents best professional practice because it acknowledges the historical roots of neurofeedback, including its development from biofeedback and early EEG research, while also emphasizing the current scientific understanding and evidence-based applications. This aligns with the ethical obligation to provide accurate and transparent information to clients, fostering trust and enabling informed decision-making about treatment. It also implicitly adheres to the BCN certification standards, which require practitioners to maintain a current understanding of the field's scientific literature and historical context. An incorrect approach that focuses solely on the earliest, less scientifically validated pioneers, without mentioning subsequent research and refinement, would be ethically problematic. This misrepresents the current state of the field and could lead to unrealistic expectations or a misunderstanding of the evidence base. Another incorrect approach that presents neurofeedback as a panacea for all neurological and psychological conditions, without acknowledging limitations or the need for individualized treatment plans, would be a violation of ethical practice and potentially misrepresent the scope of neurofeedback as recognized by professional bodies. Finally, an approach that omits any mention of the scientific evolution and relies only on anecdotal evidence would fail to meet the standards of evidence-based practice expected of BCN-certified professionals. Professionals should approach client education by first understanding the client's specific needs and background. They should then draw upon their comprehensive knowledge of neurofeedback's history, including its foundational principles, key researchers, technological advancements, and the evolution of its theoretical underpinnings and clinical applications. The information should be tailored to the client's level of understanding, presented in a balanced and objective manner, and always grounded in current scientific evidence and ethical guidelines. This ensures the client receives accurate information, understands the rationale for treatment, and can provide informed consent. Question 6. Strategic planning requires a neurofeedback practitioner to effectively gather comprehensive client history during the initial clinical interview. When a client hesitates to disclose details about a past traumatic event that they believe is impacting their current symptoms, what is the most ethically and professionally sound approach to ensure adequate clinical information is obtained while respecting client autonomy and confidentiality? Option A. Respect the client's immediate reluctance and avoid further inquiry into the traumatic event, focusing solely on the presenting symptoms and observable behaviors to avoid causing distress. Option B. Gently acknowledge their hesitation. Explain how understanding significant life experiences can inform the neurofeedback protocol, and offer to proceed at their pace, assuring them that they only need to share what they feel comfortable with, while reiterating the confidential nature of the session. Option C. Directly ask probing questions about the specifics of the traumatic event, emphasizing that a full understanding is critical for effective treatment, and explain that withholding such information could hinder progress. Option D. Suggest that the client write down the details of the traumatic event and bring it to a future session, as this may be easier for them than discussing it verbally in the current moment. The correct answer is B. Gently acknowledge their hesitation. Explain how understanding significant life experiences can inform the neurofeedback protocol, and offer to proceed at their pace, assuring them that they only need to share what they feel comfortable with, while reiterating the confidential nature of the session. Explanation. This scenario presents a common implementation challenge in neurofeedback practice, navigating client disclosure of sensitive personal information during the initial clinical interview. The professional's responsibility is to gather necessary diagnostic information while respecting client privacy and adhering to ethical guidelines and regulatory frameworks governing the practice of neurofeedback. The challenge lies in balancing the need for comprehensive data with the client's right to control their personal information and the potential for this information to impact the therapeutic relationship or diagnostic process. The correct approach emphasizes active listening, empathetic inquiry, and a clear explanation of the purpose of information gathering. This aligns with best professional practices by establishing trust, ensuring informed consent, and demonstrating respect for client autonomy. Specifically, It involves asking open-ended questions about relevant life experiences that may impact neurofeedback outcomes, such as significant stressors, trauma history, or major life changes, while clearly stating how this information will be used to tailor the treatment plan. This approach is ethically sound as it prioritizes the client's well-being and confidentiality, and it is compliant with general ethical principles of professional conduct that require practitioners to obtain necessary information for effective treatment while safeguarding client privacy. Incorrect approaches fail to adequately address the ethical and practical considerations of client disclosure. One incorrect approach might involve direct, intrusive questioning about highly personal details without sufficient context or justification, potentially violating client privacy and creating discomfort. This could be seen as a failure to obtain informed consent regarding the scope of information being collected and its relevance to treatment. Another incorrect approach might be to ignore potentially relevant information due to a reluctance to probe, which could lead to an incomplete diagnostic picture and a less effective treatment plan, thereby failing the professional duty to provide competent care. A third incorrect approach could involve making assumptions about the client's experiences based on limited information, which is unprofessional and can lead to misdiagnosis or inappropriate treatment strategies, violating the principle of evidence-based practice and potentially causing harm. Professional decision-making in such situations requires a systematic process. First, the practitioner must identify the core objective, gathering sufficient information for effective neurofeedback treatment. Second, they must consider the ethical principles at play, including beneficence, non-maleficence, autonomy, and justice. Third, they must consult relevant professional guidelines and regulatory standards for neurofeedback practice, which typically emphasize client confidentiality, informed consent, and the importance of a thorough assessment. Finally, the practitioner should employ communication techniques that are client-centered, empathetic, and transparent, allowing the client to feel safe and respected, while ensuring the necessary clinical data is obtained. Question 7. The assessment process reveals a client presenting with significant subjective reports of anxiety, persistent sleep disturbances, and notable difficulties with sustained attention. The client's QEEG shows elevated theta activity in frontal regions and increased beta activity in posterior regions. Considering the potential mechanisms of neurofeedback and the client's symptom profile, which of the following approaches best mitigates the risk of adverse outcomes while maximizing the potential for therapeutic benefit? Option A. Administering a broad-spectrum protocol aimed at general relaxation and improved brainwave coherence across all major frequency bands, without specific focus on the observed QEEG patterns. Option B. Prioritizing a protocol that the client has researched and expressed a strong preference for, even if it does not directly address the most prominent QEEG findings. Option C. Implementing a protocol that targets the reduction of frontal theta activity and the normalization of posterior beta activity, with a careful monitoring plan for any emergent symptoms. Option D. Focusing exclusively on reducing the client's reported anxiety symptoms with a standard alpha-theta protocol, disregarding the posterior beta findings and the attention difficulties. The correct answer is C. Implementing a protocol that targets the reduction of frontal theta activity and the normalization of posterior beta activity, with a careful monitoring plan for any emergent symptoms. Explanation. The assessment process reveals a client presenting with a complex interplay of symptoms, including significant anxiety, sleep disturbances, and reported difficulties with attention. The neurofeedback practitioner must navigate the inherent challenge of identifying the primary neurological underpinnings of these symptoms and selecting an appropriate neurofeedback protocol. This scenario is professionally challenging because neurofeedback mechanisms are not always straightforward, and symptoms can overlap across various dysregulations. A risk assessment approach is crucial to ensure the chosen intervention is safe, effective, and ethically sound, minimizing the risk of exacerbating symptoms or providing an ineffective treatment. The correct approach, which involves a thorough risk assessment of potential neurofeedback mechanisms and their likely impact on the client's specific symptom cluster, represents best professional practice. This aligns with the BCN's emphasis on evidence-based practice and client-centered care. By systematically evaluating how different neurofeedback protocols, e.g., targeting specific frequency bands or brain regions, might influence the observed EEG patterns and symptom presentation, the practitioner minimizes the risk of adverse effects and maximizes the probability of a positive therapeutic outcome. This methodical evaluation ensures that the chosen intervention is not only theoretically sound, but also practically appropriate for the individual client, adhering to the ethical obligation to do no harm and to provide competent care. An incorrect approach that focuses solely on the most common symptom presentation, e.g., anxiety, without a deeper risk assessment of underlying EEG patterns and potential protocol interactions, would be professionally unacceptable. This could lead to a misapplication of neurofeedback, potentially targeting the wrong brainwave activity or region, thereby failing to address the root cause of the client's distress and possibly even worsening certain symptoms. This constitutes an ethical failure to provide competent care and a violation of the principle of beneficence. Another incorrect approach, which involves immediately implementing a broad-spectrum protocol without a detailed risk assessment of potential side effects or contraindications, is also professionally unsound. While some protocols are designed to be generally calming, a lack of specific risk assessment for this individual client could overlook subtle EEG markers that might indicate a contraindication or a higher risk of adverse reactions, such as increased agitation or paradoxical effects. This demonstrates a failure in due diligence and a disregard for the individualized nature of neurofeedback treatment. Furthermore, an approach that prioritizes client preference for a specific protocol over a practitioner-led risk assessment, without thoroughly educating the client on the potential risks and benefits of that chosen protocol, is ethically problematic. While client autonomy is important, the practitioner retains the ultimate responsibility for ensuring the safety and efficacy of the treatment. Blindly following a client's preference without a professional risk assessment can lead to inappropriate treatment and potential harm, violating the practitioner's duty of care. The professional decision-making process for similar situations should involve a systematic evaluation of the client's presenting symptoms, a comprehensive review of their EEG data, and a thorough understanding of the neurophysiological mechanisms targeted by various neurofeedback protocols. This includes considering potential interactions between different brainwave activities and the likelihood of positive or negative responses based on the client's unique neurophysiology. The practitioner must then weigh the potential benefits against the identified risks for each viable protocol, engaging in shared decision-making with the client after providing clear and understandable information about the rationale, expected outcomes, and potential risks of the recommended intervention. Question 8. During the evaluation of a neurofeedback system prior to a client session, a practitioner notices that the system's last documented calibration was over a year ago, exceeding the manufacturer's recommended annual calibration interval. The system appears to be functioning normally during a brief visual and auditory check. The practitioner is under pressure to begin the session promptly due to the client's tight schedule. What is the most appropriate course of action according to BCN certification guidelines? Option A. Conduct a brief functional test of the electrodes and amplifier gain, and if these appear within normal parameters, proceed with the session. Option B. Use a backup system that has a more recent calibration, even if it is a different model than the client is accustomed to. Option C. Delay the session until the equipment can be recalibrated or validated by a qualified technician, informing the client of the necessary delay. Option D. Proceed with the session, documenting the overdue calibration and planning for it to be done as soon as possible after the session. The correct answer is D. Proceed with the session, documenting the overdue calibration and planning for it to be done as soon as possible after the session. Explanation. This scenario presents a professional challenge because the neurofeedback practitioner must balance the immediate need to provide a service with the overarching regulatory requirement for equipment validation and safety. The practitioner's responsibility extends beyond simply operating the equipment. It includes ensuring its integrity and compliance with established standards, which are critical for patient safety and the validity of the neurofeedback data. Careful judgment is required to avoid compromising patient care or violating regulatory mandates. The correct approach represents best professional practice because it prioritizes patient safety and data integrity by adhering to the BCN certification's implicit and explicit requirements for equipment maintenance and validation. This proactive stance ensures that the neurofeedback system is functioning optimally and producing reliable data, which is fundamental to effective treatment and ethical practice. By following manufacturer guidelines and performing regular checks, the practitioner demonstrates due diligence and upholds the professional standards expected of a BCN-certified individual. This aligns with the core principles of responsible neurofeedback practice, emphasizing evidence-based interventions and patient well-being. An incorrect approach that involves using equipment without recent calibration or validation poses significant regulatory and ethical failures. Specifically, it violates the implicit requirement within the BCN framework to provide services using validated and safe technology. Uncalibrated equipment can lead to inaccurate readings, potentially resulting in inappropriate treatment protocols or a lack of therapeutic benefit, thereby failing to meet the standard of care. Ethically, this constitutes a breach of trust with the patient, as they are receiving a service based on potentially flawed data. Furthermore, it could be seen as misrepresenting the efficacy of the neurofeedback service. Another incorrect approach, such as relying solely on visual inspection without functional testing, is also professionally unacceptable. While visual checks are a component of maintenance, they do not guarantee the operational accuracy or safety of the equipment. This oversight can lead to undetected malfunctions that compromise data quality and patient safety, again failing to meet the expected standard of care and potentially violating regulatory expectations for thorough equipment assessment. The professional reasoning process for similar situations should involve a systematic approach to equipment management. This includes 1. Understanding and adhering to manufacturer recommendations for calibration and maintenance schedules. 2. Implementing a routine schedule for functional testing and validation of all neurofeedback equipment. 3. Documenting all maintenance and validation activities. 4. Prioritizing patient safety and data integrity above all else when making decisions about equipment use. 5. Consulting with supervisors or regulatory bodies if there is any uncertainty regarding equipment status or compliance. Question 9. Governance review demonstrates that a neurofeedback practitioner certified by the BCN is implementing a Loretta Z-score protocol for a client diagnosed with PTSD. While the protocol is generally aligned with BCN guidelines for PTSD, the practitioner is considering significant modifications based on the client's initial subjective reports of feeling overwhelmed and a perceived lack of immediate symptom relief. Despite objective EEG data showing some shifts, what is the most appropriate course of action for the practitioner to ensure adherence to BCN standards and best practices for PTSD treatment? Option A. Continue with the established Loretta Z-score protocol for PTSD, meticulously documenting the client's subjective reports and objective EEG findings, and consider gradual, data-informed adjustments to parameters or session frequency only after further assessment and consultation if necessary. Option B. Increase the intensity of the Loretta Z-score protocol significantly to force a more rapid neurophysiological shift, assuming the client's discomfort is a sign of resistance to effective treatment. Option C. Immediately alter the Loretta Z-score protocol to a more generalized relaxation protocol, focusing solely on the client's subjective reports of feeling overwhelmed to reduce immediate distress. Option D. Discontinue the Loretta Z-score protocol for PTSD and switch to a different, less targeted neurofeedback protocol that the practitioner believes might be more subjectively comfortable for the client, without further specific assessment for PTSD. The correct answer is A. Continue with the established Loretta Z-score protocol for PTSD, meticulously documenting the client's subjective reports and objective EEG findings, and consider gradual, data-informed adjustments to parameters or session frequency only after further assessment and consultation if necessary. Explanation. Scenario analysis. This scenario presents a common implementation challenge in neurofeedback for PTSD and trauma, balancing the need for evidence-based protocols with the individualized nature of client care. The challenge lies in adhering to BCN certification guidelines, which emphasize adherence to established protocols for specific conditions like PTSD, while simultaneously recognizing that each client's trauma presentation is unique and may require protocol modifications. The pressure to demonstrate efficacy and maintain client engagement can lead to deviations from standard practice, creating a tension between protocol fidelity and clinical flexibility. Correct approach analysis. The correct approach prioritizes a systematic, protocol-driven intervention for PTSD, grounded in BCN certification requirements and current research on neurofeedback for trauma. This involves selecting a well-established protocol, e.g., Loretta Z-score training targeting specific brain regions implicated in PTSD, such as the amygdala or prefrontal cortex, and implementing it consistently. The rationale is that BCN certification implies a commitment to evidence-based practices, and for PTSD, specific protocols have demonstrated efficacy. Modifications should be carefully documented and justified based on ongoing assessment and client response, rather than being arbitrary. This approach ensures adherence to professional standards, facilitates outcome measurement, and aligns with the ethical obligation to provide competent care based on established best practices. Incorrect approaches analysis. One incorrect approach involves prematurely or extensively modifying a standard PTSD protocol based on initial client reports of discomfort or perceived lack of progress without a thorough assessment of the underlying reasons. This could lead to a de-escalation of the neurofeedback intensity or a shift to less targeted protocols, potentially undermining the efficacy of the intervention for PTSD. This failure violates the principle of protocol fidelity, which is crucial for demonstrating the effectiveness of neurofeedback and for meeting BCN certification standards. It also risks providing suboptimal care by not fully engaging with the established therapeutic pathways for PTSD. Another incorrect approach is to solely rely on client-reported subjective experiences to dictate the entire neurofeedback protocol, disregarding established neurophysiological markers and BCN-recommended protocols for PTSD. While client feedback is essential, it should inform, not dictate the protocol. This approach risks a lack of systematic intervention, making it difficult to track progress objectively and potentially leading to a protocol that is not optimally aligned with the neurobiological underpinnings of PTSD. This deviates from the evidence-based mandate of BCN certification and could be considered a failure to provide competent, evidence-informed care. A third incorrect approach is to implement a generic neurofeedback protocol that is not specifically tailored to the neurophysiological correlates of PTSD, even if it addresses general relaxation or attention. This approach fails to acknowledge the specific brain dysregulation associated with PTSD, and therefore may not yield the desired therapeutic outcomes. It represents a failure to adhere to the specialized knowledge and protocols expected for treating complex conditions like PTSD under BCN certification, potentially leading to ineffective treatment and a breach of professional responsibility. Professional reasoning. Professionals should approach neurofeedback for PTSD by first identifying and understanding the BCN-certified, evidence-based protocols for this condition. This involves a comprehensive initial assessment to identify the specific neurophysiological patterns associated with the client's PTSD symptoms. The chosen protocol should then be implemented with fidelity, with regular monitoring of both objective neurofeedback data and subjective client reports. Any necessary modifications should be data-driven, carefully documented, and justified in relation to the client's progress and the underlying neurophysiology of PTSD. This systematic approach ensures ethical practice, adherence to certification standards, and maximizes the likelihood of positive therapeutic outcomes. Question 10. The audit findings indicate that a neurofeedback practitioner is utilizing a device that is FDA cleared for general biofeedback and muscle rehabilitation, but not specifically for neurofeedback training. The practitioner asserts that the device's basic EEG acquisition capabilities are sufficient for their neurofeedback protocols. The audit team needs to determine if this device usage is compliant with BCN certification standards and best practices. Option A. The device is acceptable for neurofeedback if it is a widely used model within the practitioner's local professional network, regardless of specific regulatory clearance. Option B. The device is not acceptable for neurofeedback if it lacks specific FDA clearance for neurofeedback application, as this implies it has not been evaluated for the unique requirements of brainwave training and feedback. Option C. The device is acceptable for neurofeedback as long as the practitioner has obtained consent from the client regarding the experimental nature of the technology. Option D. The device is acceptable for neurofeedback if the practitioner can demonstrate its ability to acquire and process EEG signals relevant to the training protocols, even without specific neurofeedback FDA clearance. The correct answer is D. The device is acceptable for neurofeedback if the practitioner can demonstrate its ability to acquire and process EEG signals relevant to the training protocols, even without specific neurofeedback FDA clearance. Explanation: the scenario presents a common challenge in neurofeedback practice, ensuring that the equipment used aligns with the intended therapeutic goals and regulatory standards. The professional challenge lies in discerning the appropriate device classification and its implications for client care and compliance, especially when faced with diverse technological offerings. Careful judgment is required to avoid misrepresenting device capabilities or using equipment that may not meet established efficacy or safety benchmarks. The correct approach represents best professional practice because it prioritizes the use of devices that have undergone rigorous validation and are recognized for their efficacy in neurofeedback applications. This aligns with the ethical imperative to provide evidence-based care and to ensure client safety. Specifically, utilizing devices that are FDA cleared for neurofeedback or have a strong track record of research supporting their use in this modality demonstrates a commitment to professional standards and regulatory compliance. This ensures that the neurofeedback being delivered is based on sound scientific principles and has a reasonable expectation of therapeutic benefit. An incorrect approach involving the use of a device solely marketed for general biofeedback without specific neurofeedback clearance or validation presents a regulatory and ethical failure. Such devices may not have the necessary signal processing capabilities, electrode configurations, or software algorithms to effectively deliver neurofeedback as defined by the BCN certification standards. This could lead to ineffective treatment, misinterpretation of brainwave data, and potentially harm to the client if the feedback loop is not accurately calibrated or responsive to relevant brain activity. Furthermore, it could be considered a misrepresentation of services if the device is not suitable for the intended neurofeedback application. Another incorrect approach, using a device that is experimental or lacks peer-reviewed research supporting its use in neurofeedback, poses significant ethical risks. While innovation is important, practitioners have a duty to use interventions that have demonstrated safety and efficacy. Employing unproven technologies without adequate justification can be seen as practicing outside the scope of established neurofeedback protocols and could expose clients to unknown risks or ineffective treatments. This also fails to uphold the principle of beneficence, which requires practitioners to act in the best interest of their clients. The professional reasoning process for similar situations should involve a thorough understanding of the BCN certification requirements and relevant regulatory guidelines. Practitioners must critically evaluate any neurofeedback device by considering its intended use, regulatory clearance, e.g., FDA clearance for neurofeedback, the scientific literature supporting its application, and its technical specifications in relation to the specific neurofeedback protocols being employed. A decision-making framework should include 1. Verifying regulatory status. 2. Reviewing independent research and clinical evidence. 3. Assessing technical suitability for neurofeedback. And 4. Consulting with peers or professional organizations when in doubt. This systematic approach ensures that all equipment choices are grounded in evidence, ethics, and regulatory compliance, ultimately safeguarding client well-being and professional integrity. Question 11. Regulatory review indicates that a client presents with significant difficulties in executive functioning, including poor planning, organization, and impulse control. The neurofeedback practitioner is considering developing a protocol. Which of the following approaches best aligns with the BCN certification's emphasis on neuroanatomy and risk assessment for effective client care? Option A. Recommending a comprehensive medication review and referral to a psychiatrist, stating that neurofeedback is not equipped to address the core neuroanatomical deficits contributing to executive dysfunction. Option B. Implementing a broadband stimulation protocol across multiple brain regions, assuming that some aspect of the stimulation will eventually address the executive functioning issues. Option C. Focusing solely on reducing reported symptoms of restlessness and distractibility through a generalized alpha-theta training protocol without specific consideration of the underlying neuroanatomy. Option D. Designing a protocol targeting the prefrontal cortex and its associated networks based on its known role in executive functions and clearly explaining this rationale to the client as part of the informed consent process. The correct answer is D. designing a protocol targeting the prefrontal cortex and its associated networks, based on its known role in executive functions, and clearly explaining this rationale to the client as part of the informed consent process. Explanation. This scenario presents a professional challenge because it requires the neurofeedback practitioner to integrate complex neuroanatomical knowledge with the ethical and regulatory obligations of client care, specifically concerning informed consent and scope of practice. The practitioner must accurately assess the client's condition and determine if neurofeedback is an appropriate intervention based on their understanding of brain structures and functions, while also ensuring the client fully understands the proposed treatment and its limitations. The correct approach represents best professional practice because it prioritizes a thorough understanding of the client's neuroanatomy as it relates to their presenting symptoms. This allows for a more precise and effective neurofeedback protocol design, directly addressing the underlying neural dysregulation. This aligns with the BCN certification's emphasis on a strong foundation in neuroanatomy and its application to clinical practice. Furthermore, it supports the ethical principle of beneficence by ensuring the intervention is tailored to the individual's needs, and the principle of non-maleficence by minimizing the risk of ineffective or inappropriate treatment. Regulatory frameworks for professional practice, including those guiding BCN certification, implicitly require practitioners to operate within their area of expertise, which includes a robust understanding of neuroanatomy to inform treatment decisions. An incorrect approach that relies solely on symptom presentation without considering the underlying neuroanatomy fails to meet the standards of a comprehensive assessment. This could lead to a generic or ineffective protocol, potentially delaying appropriate treatment or even exacerbating the client's condition, which violates the principle of non-maleficence. Ethically, it represents a failure to provide competent care. Another incorrect approach that involves recommending interventions beyond the scope of neurofeedback, based on a superficial understanding of neuroanatomy, is a significant regulatory and ethical failure. This breaches the scope of practice defined by the BCN certification and professional licensing boards, potentially leading to harm and legal repercussions. It also undermines the informed consent process, as the client may not fully grasp the limitations of neurofeedback or the practitioner's expertise. The professional decision-making process for similar situations should involve a systematic approach. 1. Comprehensive assessment. Begin with a thorough evaluation of the client's symptoms, history, and any available diagnostic information. 2. Neuroanatomical correlation. Actively link the presenting symptoms to specific brain structures and functional networks using established neuroanatomical knowledge. 3. Protocol design. Develop a neurofeedback protocol that directly targets the identified neural dysregulation based on the neuroanatomical understanding. 4. Informed consent. Clearly communicate the rationale for the chosen protocol, its expected outcomes, potential risks, and limitations, all grounded in the neuroanatomical basis of the intervention. 5. Scope of practice adherence. Ensure all proposed interventions fall within the defined scope of practice for a certified neurofeedback practitioner. 6. Ongoing evaluation. Continuously monitor client progress and adjust the protocol as needed, always referencing the neuroanatomical underpinnings of the treatment. Question 12. Stakeholder feedback indicates a need to enhance the systematic collection and analysis of neurofeedback session data to improve treatment efficacy and client outcomes. Considering best practices in data management and client confidentiality, which of the following approaches best aligns with professional standards for a BCN-certified practitioner? Option A. Utilize readily available, free online data aggregation tools to store and analyze session data, prioritizing ease of access and cost-effectiveness over data security protocols. Option B. Implement a standardized protocol for obtaining explicit, informed consent from clients regarding the collection, storage, and analysis of their neurofeedback data, coupled with robust data encryption and secure storage solutions. Option C. Focus solely on collecting subjective client self-reports after each session, as this is the most direct measure of client experience and requires no complex data management or security considerations. Option D. Begin collecting all available session data points without explicit client notification, assuming that such data is implicitly part of the treatment process and will be used solely for internal improvement. The correct answer is B. Implement a standardized protocol for obtaining explicit informed consent from clients regarding the collection, storage, and analysis of their neurofeedback data, coupled with robust data encryption and secure storage solutions. Explanation: this scenario is professionally challenging because it requires balancing the need for comprehensive data collection with the ethical and regulatory obligations to protect client privacy and ensure data integrity. The BCN certification framework emphasizes the importance of accurate, reliable, and ethically obtained data for effective neurofeedback practice. Professionals must navigate the complexities of data management, storage, and analysis while adhering to established best practices and any applicable regulations governing health information. The correct approach represents best professional practice because it prioritizes client consent and data security, aligning with the ethical principles of beneficence and non-maleficence, as well as the BCN's emphasis on responsible data handling. Obtaining informed consent for data collection and analysis ensures clients understand how their information will be used, empowering them to make informed decisions. Implementing robust data security measures protects sensitive client information from unauthorized access or breaches, a critical component of maintaining trust and complying with privacy standards. Regular data review and analysis by qualified professionals are essential for accurate assessment and treatment planning, directly contributing to client well-being and the efficacy of neurofeedback interventions. An incorrect approach that involves collecting data without explicit client consent fails to uphold the principle of autonomy and violates ethical guidelines regarding informed consent. This can lead to a breach of trust and potential regulatory violations if health information is handled improperly. Another incorrect approach that neglects data security measures exposes clients to significant risks of privacy breaches and identity theft, which is a direct contravention of the duty to protect client confidentiality and can have severe legal and ethical repercussions. Furthermore, relying on unverified or inconsistently collected data for analysis undermines the scientific rigor of neurofeedback practice and can lead to misdiagnosis or ineffective treatment, failing to meet the standard of care expected of certified professionals. The professional decision-making process for similar situations should involve a thorough understanding of BCN ethical guidelines and any relevant local or national regulations pertaining to client data. Professionals should always prioritize obtaining explicit, informed consent from clients before collecting any data. They must implement and maintain secure data storage and management systems that comply with privacy standards. Regular professional development in data analysis techniques and ethical data handling is crucial. When in doubt, consulting with supervisors, mentors, or legal counsel specializing in healthcare privacy is a prudent step to ensure compliance and uphold the highest professional standards. Question 13. The control framework reveals a neurofeedback practitioner observing a client's EEG data, which displays a notable excess of slow-wave activity in the theta band, 4-7 Hz, across frontal and central regions, coupled with a deficit in faster beta frequencies, 15-20 Hz, in similar areas. The client reports significant challenges with sustained attention, distractibility, and a tendency towards impulsive behaviors. Considering the BCN certification requirements and ethical guidelines, which of the following represents the most appropriate initial course of action for the practitioner? Option A. Focus solely on the theta/beta ratio as the primary indicator and implement a standardized training protocol designed to normalize this ratio across all clients presenting with similar EEG signatures. Option B. Immediately initiate a neurofeedback protocol targeting the reduction of theta activity and the enhancement of beta activity in the affected regions based on the prominent EEG findings. Option C. Recommend the client seek a psychiatric evaluation for potential medication management, as the EEG patterns strongly suggest a diagnosis requiring pharmacological intervention. Option D. Conduct a comprehensive clinical interview, gather detailed symptom history, and consider additional psychometric assessments to contextualize the EEG findings before designing a treatment plan. The correct answer is B. Immediately initiate a neurofeedback protocol targeting the reduction of theta activity and the enhancement of beta activity in the affected regions based on the prominent EEG findings. Explanation: the control framework reveals that a neurofeedback practitioner is presented with a client exhibiting significant difficulties with attention and impulse control. EEG data shows a prominent pattern of high amplitude, low theta waves, 4-7 Hz in frontal regions, co-occurring with reduced beta wave activity, 15-20 Hz, in the same areas. This scenario is professionally challenging because accurately interpreting these brainwave patterns and their implications for intervention requires a deep understanding of neurophysiology, the specific diagnostic criteria for attention-related conditions, and the ethical guidelines governing neurofeedback practice. Misinterpretation can lead to ineffective or even harmful interventions, impacting client outcomes and professional reputation. The correct approach represents best professional practice because it prioritizes a comprehensive, evidence-based assessment before initiating neurofeedback. This involves not only analyzing the raw EEG data, but also integrating it with a thorough clinical interview, behavioral observations, and potentially other psychometric assessments. This holistic approach ensures that the neurofeedback intervention is tailored to the individual's specific needs and is aligned with established diagnostic frameworks. Adherence to BCN certification standards mandates this level of due diligence, ensuring that interventions are safe, ethical, and effective, and that the practitioner is acting within their scope of practice. An incorrect approach that focuses solely on the theta/beta ratio without considering the broader clinical picture is professionally unacceptable. This failure constitutes a regulatory and ethical lapse because it bypasses essential diagnostic steps and relies on a potentially oversimplified interpretation of EEG data. Such an approach risks misdiagnosing the underlying issues or applying a generic protocol that may not address the client's unique presentation, potentially violating the principle of beneficence, acting in the client's best interest, and non-maleficence, avoiding harm. Furthermore, it may not meet the standards of care expected within the neurofeedback profession, as defined by BCN guidelines, which emphasize individualized treatment plans. Another incorrect approach that involves immediately implementing a standard theta/beta training protocol without further assessment is also professionally unacceptable. This bypasses the critical step of differential diagnosis and can lead to inappropriate treatment. Ethically, this violates the principle of informed consent, as the client may not fully understand the rationale or potential efficacy of the proposed intervention based on incomplete assessment. From a regulatory standpoint, it demonstrates a lack of adherence to best practices in clinical neurofeedback, which requires a thorough understanding of the client's condition before intervention. A third incorrect approach that involves recommending medication based solely on the observed EEG patterns, without consulting with a qualified medical professional or conducting a comprehensive medical and psychological evaluation, is a severe regulatory and ethical failure. This oversteps the scope of practice for a neurofeedback practitioner and can have serious consequences for the client's health and well-being. It directly violates ethical guidelines regarding professional boundaries and the referral process, potentially leading to inappropriate medical management and undermining the collaborative care model. The professional decision-making process for similar situations should involve a systematic approach. 1. Thorough client assessment. Conduct a comprehensive clinical interview, gather detailed history, and perform behavioral observations. 2. EEG data interpretation. Analyze EEG patterns in the context of the client's symptoms and history, considering various contributing factors. 3. Differential diagnosis. Consider potential underlying conditions that may explain the observed EEG patterns and symptoms. 4. Integration of information. Synthesize all gathered information to form a holistic understanding of the client's needs. 5. Treatment planning. Develop an individualized neurofeedback treatment plan based on the comprehensive assessment and in alignment with BCN standards. 6. Collaboration and referral. Consult with other healthcare professionals when necessary and make appropriate referrals. 7. Ongoing monitoring and adjustment. Continuously evaluate the client's progress and adjust the treatment plan as needed. Question 14. Implementation of a neurofeedback protocol based solely on a client's expressed preference for a specific, unverified technique, without a comprehensive assessment or professional recommendation, raises ethical considerations regarding practitioner responsibility and client well-being. A client with a history of anxiety and sleep disturbances requests a neurofeedback protocol they read about online, claiming it specifically targets their symptoms. However, your initial assessment suggests a different, more established protocol might be more appropriate for their presentation. Option A. Refuse to implement the client's requested protocol and insist on your recommended approach, stating that your professional judgment supersedes their preferences. Option B. Immediately implement the client's requested protocol to honor their autonomy and build rapport, assuming their research indicates a valid approach. Option C. Suggest the client research alternative practitioners who specialize in the specific protocol they are requesting, as you do not offer it. Option D. Conduct a thorough assessment. Explain your professional recommendation based on evidence-based practice and the client's specific needs, and collaboratively develop a treatment plan that addresses their concerns while incorporating your expertise. Correct answer is D. Conduct a thorough assessment. Explain your professional recommendation based on evidence-based practice and the client's specific needs, and collaboratively develop a treatment plan that addresses their concerns while incorporating your expertise. Explanation. This scenario presents a common ethical challenge in neurofeedback practice, balancing client autonomy and informed consent with the practitioner's professional judgment and the potential for harm. The practitioner must navigate the client's expressed desire for a specific protocol against the evidence-based understanding of what is most appropriate for their condition. The professional challenge lies in respecting the client's right to make decisions about their treatment, while ensuring that the treatment itself is safe, effective, and ethically administered, adhering to the standards of practice expected for BCN certification. The correct approach represents best professional practice because it prioritizes client well-being and adherence to ethical guidelines for neurofeedback practitioners. It involves a thorough assessment, clear communication of findings and recommendations, and collaborative decision-making with the client. This approach upholds the principle of informed consent, ensuring the client understands the rationale behind the proposed protocol and any potential risks or benefits, thereby empowering them to make an informed choice. It also aligns with the ethical imperative to practice within one's scope of competence and to utilize evidence-based protocols. An incorrect approach that involves immediately implementing the client's requested protocol without further assessment or discussion fails to uphold the practitioner's ethical responsibility to provide competent and appropriate care. This could lead to ineffective treatment, wasted resources, and potentially exacerbate the client's condition if the requested protocol is not suitable. It bypasses the crucial step of professional judgment and evidence-based practice, violating the principle of beneficence, acting in the client's best interest. Another incorrect approach, which is to dismiss the client's request outright and refuse to consider any alternative, demonstrates a lack of respect for client autonomy and can damage the therapeutic relationship. While the practitioner's professional judgment is paramount, a collaborative approach that educates the client and explores their reasoning behind the request is generally more effective and ethical than an authoritarian stance. This approach risks alienating the client and may lead them to seek treatment elsewhere, potentially without adequate guidance. The professional reasoning process for similar situations should involve a systematic approach. 1. Conduct a comprehensive assessment to understand the client's condition, history, and goals. 2. Formulate a professional opinion based on evidence-based practices and clinical expertise. 3. Communicate findings and recommendations clearly and empathetically to the client, explaining the rationale. 4. Actively listen to the client's concerns, preferences, and reasoning for their requests. 5. Engage in a collaborative discussion to reach a mutually agreed-upon treatment plan that balances client input with professional expertise. 6. Document all assessments, discussions, and decisions thoroughly. 7. If a client's request is deemed inappropriate or potentially harmful, clearly explain the reasons and offer alternative, evidence-based solutions. Question 15. Cost-benefit analysis shows that for clients presenting with generalized anxiety and mild depressive symptoms, a systematic approach to neurofeedback protocol selection, which involves initial QEEG assessment to identify specific dysregulation patterns, and then applying evidence-based protocols targeting those patterns with ongoing client feedback for adjustments, yields the most favorable outcomes. Which of the following best represents this best practice approach? Option A. Utilizing a flexible protocol that begins with a comprehensive QEEG assessment to identify specific neurofeedback targets, followed by the application of evidence-based protocols tailored to those targets, with continuous monitoring and adjustment based on client progress and feedback. Option B. Implementing a standardized Loretta protocol for alpha-theta training for all clients diagnosed with anxiety and depression, regardless of their specific EEG findings or symptom presentation. Option C. Prioritizing client requests for specific neurofeedback protocols, such as SMR training for sleep, even if their QEEG does not strongly indicate this as the primary target for their anxiety and depression symptoms. Option D. Adopting the latest experimental neurofeedback techniques reported in recent literature for anxiety and depression, without a clear rationale linked to the client's individual EEG patterns, or without prior validation in peer-reviewed studies. Correct answer is B. Implementing a standardized Loretta protocol for alpha-theta training for all clients diagnosed with anxiety and depression, regardless of their specific EEG findings or symptom presentation. Explanation. This scenario presents a common challenge in neurofeedback practice, balancing evidence-based protocols with individual client needs and the evolving nature of research. The professional must critically evaluate different protocol approaches for anxiety and depression, considering not only efficacy, but also adherence to established best practices and ethical guidelines within the BCN certification framework. The correct approach prioritizes a systematic, individualized, and evidence-informed strategy. This involves a thorough initial assessment to identify specific symptom clusters and EEG patterns associated with the client's anxiety and depression. Subsequently, selecting a protocol that has demonstrated efficacy for those specific patterns, while remaining flexible to adjust based on ongoing assessment and client feedback, represents best professional practice. This aligns with the BCN's emphasis on competency, ethical practice, and the application of scientifically validated neurofeedback techniques. The BCN framework implicitly requires practitioners to stay abreast of current research and to tailor interventions, rather than applying a one-size-fits-all method. An incorrect approach would be to rigidly adhere to a single, generalized protocol for all anxiety and depression presentations, without considering individual EEG characteristics or symptom profiles. This fails to acknowledge the heterogeneity of these conditions and the nuanced responses to neurofeedback. Ethically, this could lead to suboptimal outcomes or even harm if the chosen protocol is not appropriate for the individual's neurophysiology. It also risks violating the principle of beneficence by not providing the most effective care possible. Another incorrect approach would be to adopt novel or experimental protocols without sufficient empirical support or without a clear rationale tied to the client's specific presentation. While innovation is important, the BCN certification implies a commitment to evidence-based practice. Implementing unvalidated techniques without rigorous justification or informed consent could be considered unethical and potentially outside the scope of recognized neurofeedback practice. A third incorrect approach might involve prioritizing client preference for a specific protocol over clinical assessment and evidence. While client collaboration is crucial, the practitioner's expertise and adherence to established protocols are paramount in ensuring safety and efficacy. Blindly following a client's request for a particular protocol, especially if it contradicts clinical findings, would be a failure of professional judgment and could lead to ineffective treatment. The professional decision-making process should involve a continuous cycle of assessment, intervention, and reevaluation. This includes 1. Conducting a comprehensive intake and EEG assessment. 2. Identifying evidence-based protocols that target the observed EEG patterns and symptoms. 3. Implementing the chosen protocol while closely monitoring client progress and subjective reports. 4. Making data-driven adjustments to the protocol as needed. And 5. Documenting all decisions and outcomes meticulously. This systematic approach ensures that treatment is both ethical and effective, adhering to the standards expected of a BCN-certified professional. Question 16. Cost-benefit analysis shows that while neurofeedback can be an effective intervention for various conditions, a crucial first step in identifying potential candidates involves a comprehensive evaluation that considers not only the presenting symptoms, but also the individual's overall health profile and the availability of other evidence-based treatments. Which of the following best represents this best practice approach for candidate identification? Option A. Offering neurofeedback as a primary intervention for all clients seeking mental health support, assuming its broad applicability and potential benefits across a wide range of presentations. Option B. Recommending neurofeedback for any individual presenting with symptoms commonly associated with conditions that research suggests may respond to neurofeedback, regardless of other contributing factors or alternative treatments. Option C, relying primarily on a diagnosis from another healthcare provider as the sole criterion for initiating a neurofeedback assessment, without conducting an independent evaluation of the client's suitability. Option D, conducting a thorough clinical interview, reviewing relevant medical and psychological history, and assessing the client's specific symptom presentation and functional goals to determine if neurofeedback is the most appropriate and indicated intervention. The correct answer is D, conducting a thorough clinical interview, reviewing relevant medical and psychological history, and assessing the client's specific symptom presentation and functional goals to determine if neurofeedback is the most appropriate and indicated intervention. Explanation. This scenario presents a professional challenge because identifying suitable neurofeedback candidates requires a nuanced understanding of individual client needs, potential contraindications, and the ethical imperative to provide effective and safe interventions. It is not simply about identifying a condition that might respond to neurofeedback, but rather a comprehensive assessment to determine if neurofeedback is the most appropriate and beneficial intervention for that specific individual, considering their overall health, history, and goals. Careful judgment is required to avoid offering services that are not indicated, potentially leading to wasted resources, client dissatisfaction, and ethical breaches. The correct approach represents best professional practice because it prioritizes a thorough, individualized assessment that goes beyond a simple diagnostic label. This aligns with the ethical guidelines of the BCN certification, which emphasize client welfare, informed consent, and the principle of do no harm. A comprehensive evaluation ensures that neurofeedback is offered only when there is a reasonable expectation of benefit and when it is the most suitable intervention among available options. This approach respects the client's autonomy and financial investment by ensuring that services are evidence-based and tailored to their unique presentation. Offering neurofeedback based solely on a diagnosis without a comprehensive assessment is a significant regulatory and ethical failure. It violates the principle of providing services only when indicated and potentially misrepresents the efficacy of neurofeedback for a given individual. This could lead to a breach of professional standards by offering a service that may not be effective or appropriate, thus failing to act in the client's best interest. Furthermore, it bypasses the crucial step of informed consent, as the client may not fully understand the limitations or the necessity of the proposed intervention. The professional decision-making process for similar situations should involve a systematic approach. 1. Conduct a detailed clinical interview and history taking, including medical, psychological, and developmental factors. 2. Review existing diagnostic information and consider the need for further assessment, e.g., psychological testing, medical evaluations, to rule out contraindications or identify co-occurring conditions. 3. Evaluate the client's specific symptoms and functional impairments in relation to the established research and clinical applications of neurofeedback. 4. Consider alternative or complementary interventions and discuss these with the client. 5. Formulate a treatment plan that is individualized, evidence-informed, and clearly communicates expected outcomes, potential risks, and the duration of treatment. 6. Obtain informed consent, ensuring the client understands the rationale for neurofeedback, its limitations, and their right to withdraw at any time. Question 17. System analysis indicates a client seeking neurofeedback for anxiety presence with a strong personal preference for a specific protocol they read about online, which they believe will be most effective. The neurofeedback practitioner has conducted a QEEG assessment and identified several potential target areas and protocols that differ from the client's preferred method. The practitioner must decide how to proceed. Which of the following represents the most ethically and professionally sound approach according to BCN certification guidelines? Option A. Conduct a thorough assessment of the client's neurophysiological data and presenting concerns. Develop an individualized protocol based on this assessment and evidence-based practices, and then discuss this proposed protocol with the client, explaining the rationale and incorporating their input where appropriate and professionally justifiable. Option B. Proceed with a generalized, commonly used protocol for anxiety, as this is likely to be effective for most individuals presenting with similar symptoms, regardless of their specific QEEG findings. Option C. Inform the client that their preferred protocol is not evidence-based and refuse to treat them unless they agree to a protocol chosen solely by the practitioner without further discussion. Option D. Implement the protocol the client specifically requested, as their stated preference is the primary driver for treatment, ensuring they feel heard and respected. Correct answer is A. Conduct a thorough assessment of the client's neurophysiological data and presenting concerns. Develop an individualized protocol based on this assessment and evidence-based practices, and then discuss this proposed protocol with the client, explaining the rationale and incorporating their input where appropriate and professionally justifiable. Explanation. This scenario presents a professional challenge because it requires the neurofeedback practitioner to balance the client's stated preferences with evidence-based protocols and ethical considerations, all within the framework of BCN certification requirements. The practitioner must navigate potential conflicts between client autonomy and the professional's responsibility to provide effective and safe treatment. The BCN certification, while not a direct regulatory body in the same way as a state licensing board, sets professional standards and ethical guidelines that certified individuals are expected to uphold. These standards emphasize client well-being, informed consent, and the use of scientifically validated methods. The correct approach represents best professional practice because it prioritizes a thorough assessment and the development of a protocol grounded in the client's specific neurophysiological data and presenting concerns, while also incorporating client input in a collaborative manner. This aligns with BCN ethical guidelines that stress individualized treatment plans based on objective assessment and the practitioner's professional judgment. It ensures that the protocol is not solely driven by anecdotal evidence or a desire to please the client, but rather by a systematic, evidence-based approach to neurofeedback. An incorrect approach that solely relies on the client's self-reported preference for a specific protocol without a comprehensive assessment fails to meet the professional standard of care. This could lead to an ineffective or even detrimental treatment, violating the ethical principle of non-maleficence. It also bypasses the crucial step of objective data collection and analysis that underpins effective neurofeedback. Another incorrect approach, which involves implementing a protocol based on a generalized understanding of a condition without tailoring it to the individual's unique EEG patterns, also represents a failure to adhere to best practices. BCN standards emphasize individualized treatment. This approach risks treating symptoms rather than the underlying neurophysiological dysregulation, potentially wasting the client's time and resources and failing to achieve the desired outcomes. A further incorrect approach, which involves disregarding the client's concerns about a particular protocol and proceeding without addressing them, demonstrates a lack of respect for client autonomy and a failure in communication. While the practitioner's professional judgment is paramount, ethical practice requires open dialogue and addressing client anxieties or preferences in a constructive way. Ignoring these can erode trust and compromise the therapeutic alliance. The professional reasoning process should involve 1. Conducting a comprehensive initial assessment, including QEEG and symptom checklists. 2. Analyzing the assessment data to identify specific neurophysiological patterns and their relationship to the client's concerns. 3. Developing a preliminary, evidence-based protocol tailored to the individual's data. 4. Discussing the proposed protocol with the client, explaining the rationale, expected outcomes, and potential alternatives, and incorporating their feedback where appropriate and professionally sound. 5. Obtaining informed consent for the chosen protocol. 6. Continuously monitoring progress and adjusting the protocol as needed based on ongoing assessment and client feedback. Question 18. Investigation of a new client presenting with significant anxiety and sleep disturbances reveals a history of trauma. The neurofeedback practitioner is considering several system options. Which approach to system selection best aligns with BCN certification standards and ethical practice? Option A. Opt for the system that the practitioner is most familiar with from previous, unrelated clinical experiences, assuming its general neurofeedback capabilities will suffice. Option B. Select a system that has a strong research base for treating anxiety and sleep disorders, particularly those linked to trauma, and can deliver protocols known to be effective for these conditions. Option C. Choose a system that offers the most cutting-edge features and the widest range of potential protocols, even if its specific efficacy for trauma-related anxiety and sleep issues is not extensively documented. Option D. Prioritize a system that is the most cost-effective and readily available, regardless of its specific suitability for the client's complex presentation. The correct answer is B. Select a system that has a strong research base for treating anxiety and sleep disorders, particularly those linked to trauma, and can deliver protocols known to be effective for these conditions. Explanation. Scenario analysis. This scenario presents a common challenge in neurofeedback practice where a practitioner must select the most appropriate system for a client's specific needs, considering both efficacy and regulatory compliance. The challenge lies in balancing the client's presenting issues with the available technology and the ethical imperative to use evidence-based practices within the scope of BCN certification. Misjudging the system's suitability can lead to suboptimal outcomes, wasted resources, and potential ethical breaches. Correct approach analysis. The correct approach involves a thorough assessment of the client's diagnostic information, symptom presentation, and treatment goals. This assessment then guides the selection of a neurofeedback system that is well established in the literature for addressing those specific conditions and symptoms. For BCN certification, this implies utilizing systems that have demonstrated efficacy through peer-reviewed research and are recognized within the professional neurofeedback community. The practitioner must be able to articulate the rationale for their choice based on the client's individual profile and the system's known capabilities and limitations, ensuring alignment with best practices and ethical standards of care. Incorrect approaches analysis. Selecting a system solely based on its advanced features or perceived novelty without a clear link to the client's specific needs or established research is a regulatory and ethical failure. This approach prioritizes technology over evidence-based practice and client-centered care, potentially leading to ineffective treatment and a violation of the duty to provide competent care. Choosing a system based on personal preference or familiarity without considering its suitability for the client's presenting issues is also professionally unacceptable. This demonstrates a lack of objective clinical judgment and a failure to adhere to the principle of providing individualized treatment. It can result in a misapplication of neurofeedback, potentially exacerbating symptoms or failing to achieve desired outcomes, which contravenes ethical obligations. Opting for a system that is less expensive or more readily available without verifying its appropriateness for the client's condition is a significant ethical lapse. Cost and convenience should not override the primary responsibility to select the most effective and evidence-based treatment modality. This can be seen as a failure to act in the client's best interest and a potential violation of professional standards. Professional reasoning. Professionals should employ a systematic decision-making process that begins with a comprehensive client assessment. This assessment should inform the selection of neurofeedback protocols and, consequently, the type of system best suited to deliver those protocols effectively. The practitioner must consult current research, professional guidelines, and their own training and experience to make an informed choice. Transparency with the client regarding the rationale for system selection and expected outcomes is also crucial. When in doubt, seeking consultation with experienced colleagues or supervisors is a hallmark of responsible practice. Question 19. What factors determine the appropriateness of a neurofeedback practitioner's response when a client requests a specific, non-standard neurofeedback protocol that the practitioner has not previously utilized or extensively researched? Option A. The practitioner's dismissal of the client's request due to its deviation from standard protocols, without further discussion or exploration of the client's rationale. Option B. The practitioner's immediate implementation of the client's requested protocol to ensure client satisfaction and maintain rapport. Option C. The practitioner's thorough assessment of the client's needs, a transparent discussion of the requested protocol's potential risks, benefits, and alternatives, and a commitment to seeking supervision or consultation if the protocol falls outside their expertise. Option D. The practitioner's decision to proceed with the requested protocol solely based on the client's strong insistence, despite personal reservations about its efficacy or safety. The correct answer is C. The practitioner's thorough assessment of the client's needs, a transparent discussion of the requested protocol's potential risks, benefits, and alternatives, and a commitment to seeking supervision or consultation if the protocol falls outside their expertise. Explanation. Scenario analysis. This scenario is professionally challenging because it requires a neurofeedback practitioner to navigate the complex interplay between client autonomy, the practitioner's scope of practice, and the ethical imperative to provide safe and effective care. The practitioner must balance the client's expressed desires with their professional judgment regarding the appropriateness and safety of a particular neurofeedback protocol, especially when the client's request might deviate from standard or evidence-based practices. This necessitates careful consideration of potential risks and benefits, informed consent, and the practitioner's own competence. Correct approach analysis. The correct approach represents best professional practice because it prioritizes client safety and well-being while adhering to ethical guidelines for informed consent and professional competence. By engaging in a thorough discussion with the client about the rationale, potential risks, benefits, and alternatives to the requested protocol, the practitioner ensures that the client can make an informed decision. This aligns with the ethical principle of autonomy and the regulatory requirement for informed consent. Furthermore, the practitioner's commitment to consulting with supervisors or peers if the request falls outside their expertise demonstrates adherence to the ethical principle of competence and the regulatory expectation of seeking appropriate guidance to ensure client safety. This collaborative and cautious approach safeguards the client and upholds professional standards. Incorrect approach is analysis. One incorrect approach involves immediately implementing the client's requested protocol without thorough assessment or discussion. This fails to meet the regulatory and ethical requirements for informed consent, as the client may not fully understand the implications or potential risks. It also bypasses the professional obligation to assess the appropriateness and safety of the intervention, potentially leading to ineffective treatment or harm, which is a direct violation of ethical practice and regulatory oversight. Another incorrect approach is to dismiss the client's request outright without exploring their reasoning or offering alternatives. This can be perceived as paternalistic and may damage the therapeutic alliance, hindering effective treatment. Ethically, it fails to respect client autonomy and the collaborative nature of neurofeedback therapy. From a regulatory standpoint, it may not adequately address the client's needs or explore all potentially beneficial interventions within the practitioner's scope. A third incorrect approach is to proceed with a protocol that the practitioner feels is not optimal or potentially risky, simply to appease the client. This violates the core ethical duty to do no harm and compromises professional integrity. It also disregards the practitioner's responsibility to provide evidence-based and safe interventions, which is a fundamental regulatory expectation for certified practitioners. Professional reasoning. Professionals should approach such situations by first actively listening to and understanding the client's request and their underlying motivations. This should be followed by a comprehensive assessment of the client's clinical presentation and history. Next, the practitioner must evaluate the requested protocol against established neurofeedback principles, research, and their own competence. If the request aligns with best practices and is within the practitioner's expertise, informed consent should be obtained. If there are concerns, a transparent discussion about the rationale, potential risks, benefits, and alternatives is crucial. If the request falls outside the practitioner's scope or expertise, seeking supervision or consultation is paramount. The decision-making process should always be guided by the paramount principles of client safety, informed consent, and professional competence, as mandated by regulatory frameworks and ethical codes. Question 20. When evaluating the suitability of neuropsychological assessment tools to inform a neurofeedback treatment plan for a client presenting with attention deficits and executive function challenges, which approach best aligns with the BCN certification's emphasis on evidence-based practice and client-centered care? Option A. Employing assessment tools that are novel and cutting-edge, even if they lack extensive peer-reviewed validation or established norms for the target population. Option B. Relying primarily on self-report questionnaires and informal observations to gauge the client's cognitive strengths and weaknesses, as these are often quicker to administer. Option C. Utilizing a broad range of popular assessment tools that are commonly used in clinical settings, regardless of their specific relevance to neurofeedback or their psychometric validation for this population. Option D. Selecting tools with strong psychometric properties that have demonstrated efficacy in assessing attention and executive functions, and whose results can be directly translated into neurofeedback protocols. The correct answer is D. Selecting tools with strong psychometric properties that have demonstrated efficacy in assessing attention and executive functions, and whose results can be directly translated into neurofeedback protocols. Explanation. This scenario is professionally challenging because the neurofeedback practitioner must select neuropsychological assessment tools that are not only relevant to the client's presenting concerns, but also adhere to the ethical and legal standards governing the practice of neurofeedback, as defined by the BCN certification requirements. The practitioner must demonstrate competence in understanding the psychometric properties of various assessment tools and their appropriate application within the scope of neurofeedback practice, ensuring client safety and efficacy of treatment. The correct approach represents best professional practice because it prioritizes the use of assessment tools that are evidence-based, psychometrically sound, and directly inform the neurofeedback treatment plan. This aligns with the BCN's emphasis on a data-driven and client-centered approach, ensuring that interventions are tailored to individual needs and that progress can be objectively measured. Adhering to these standards is crucial for maintaining professional integrity and fulfilling the practitioner's ethical obligation to provide competent care. An incorrect approach that relies on anecdotal evidence or tools not validated for neuropsychological assessment would represent a significant regulatory and ethical failure. Such an approach could lead to misdiagnosis, inappropriate treatment planning, and potentially harm to the client, violating the BCN standards for professional conduct and the ethical principles of beneficence and non-maleficence. Similarly, using assessment tools outside the practitioner's scope of competence, without appropriate referral or supervision, would be a direct violation of ethical guidelines and potentially legal statutes regarding professional practice. The professional reasoning process should involve a thorough review of the client's history and presenting symptoms, followed by a systematic evaluation of available neuropsychological assessment tools. This evaluation should consider the tool's validity, reliability, cultural appropriateness, and relevance to the specific neurofeedback goals. Consultation with supervisors or peers, particularly when encountering complex cases or unfamiliar assessment methodologies, is a critical component of responsible practice and ensures adherence to best practices and regulatory requirements.